At VA, our community partners are key to making sure veterans have access to timely, high-quality health care. When VA refers a veteran to a community provider, a detailed authorization is issued by VA or one of VA's third-party administrators, TPAs. The authorization allows the community provider to provide care to the veteran and for VA or the TPA to pay for the care. After a community provider furnishes care to a veteran based on the scope of services in the authorization, a claim for reimbursement should be filed with the appropriate authorizing party, either VA or TPA. Instructions for filing the claim are included in the authorization. Filing claims and supporting documentation electronically is recommended because it reduces the risk of errors and speeds up reimbursement. While not required to process a claim for authorized services, medical documentation should be submitted to the authorizing VA medical facility as soon as possible after care has been provided. This is important because it allows VA to incorporate it into the veteran's medical record. Please note that for care authorized through a TPA, claims for reimbursement can only be filed with the appropriate TPA that generated the authorization. For community providers who provide emergency care to a veteran, VA must be notified within 72 hours of the emergency room visit. Upon notification and after receiving supporting documentation, VA may generally approve payment for emergency care based on whether the care provided is related to a veteran's service-connected condition, if the community provider is in VA's network, and whether or not VA was notified within 72 hours. If the emergency care is approved after appropriate notification, an authorization will be generated by VA or a TPA and provided to the community provider. Claims for that care should be filed according to instructions in the authorization. In some cases, emergency care may not be authorized. This generally occurs when the care provided is not related to a veteran's service-connected condition, the community provider is not in VA's network, and/or VA was not notified within 72 hours. When the community provider is out of network and/or VA was not notified within 72 hours, claims may be filed with the nearest VA medical facility for reimbursement consideration. In addition, please note the following about unauthorized emergency care claims. VA may require and request medical documentation, and community providers should use electronic claim and documentation submission processes. After a claim has been filed and processed, it will be classified as accepted, approved for payment, or denied. Claims are denied when the care was not authorized and when the veteran does not meet eligibility requirements. To avoid having a claim denied, make sure you have received an official authorization to provide care from either VA or the TPA. Include the authorization number with the claim, and make sure the care being requested for reimbursement is within the scope of that authorization. Claims are also denied when they cannot be paid due to billing errors or the need for more information. To avoid having a claim denied, include the authorization number in the referral authorization field. Check the accuracy of billing codes. Make sure claims are submitted in accordance with nationally standardized billing requirements. Include the veteran's full 9-digit Social Security number in the insured's ID number field. Send the claims to the correct authorizing party, VA or TPA. And for emergency care claims, medical documentation may be required, such as the ER report, and for inpatient care, history and physical, discharge summary, and progress notes. To find out the status of a claim filed with a TPA, contact the appropriate TPA. For claims filed directly with the VA, community providers can check VA's Customer Engagement Portal, or CEP, at this website. Registration is required. To learn more about filing claims for veteran community care, visit our website at this address.